Absolutely. So my name is Devon Kim, and I'm the CEO of Hassey and Long. I am also the executive director of a Compass Project, which we think of as our nonprofit arm.
My name is Adrianne Nuñez, and I am the Associate Director of External Affairs here at the Willow Domestic Violence Center.
Hi, I'm James Chiselum. I'm the Executive Director of the Lawrence Community Shelter.
You know, our for-profit business saw the need in the community. And so in 2018, we created a Compass Project in order to get more involved in connecting community members. The only way we were able to serve members of the community on the for-profit side is if they ended up in the ER without health insurance. And that's great that we're able to be there for them when they show up there. But we saw the need to maybe get out of the ER and help folks before they ended up there, help someone get access to primary care, better transportation services, actually connect them with food before there was an emergency. That's why we started a Compass Project.
So I think Willow Domestic Violence Center is really connected to so many of the other issues that we're dealing with just in general, whether that's inequality, housing issues, food insecurity. All of it really can tie together in certain ways. For me, when I think about how domestic violence might, affect public health, we might think of the physical violence. And a while back, we did a study with KU where they did the study saying this is the true cost of domestic violence. Like when someone loses their job, or when someone has to go to court for these things, or if they have to use these services, it costs this much money to help them through that versus this much money to maybe help them in the beginning and get them to shelter or something.
Here at the Lawrence Community Shelter, we begin by developing relationships while we provide emergency shelter. In doing that, we get to learn who people are. And in learning who people are, we kind of get an idea of what people need. And one of the things we've identified is that people have a lot of needs. It's not just that they're unhoused or unsheltered, it's that they might have had a background of significant trauma, and sometimes that manifests itself in a way where it appears that they don't like people. They don't like anything about anything people provide to them, but that's not the case. The case is that they don't have a lot of trust in the system or in people. And so we try to break down some of those barriers by getting to know people.
When I found out that I'd been chosen to receive the award, I was so surprised. I've actually followed this award over the years and just been really impressed by the folks that have done so much in the community. I may be the leader of the organization, but I'm not actually the person that most of the people in the community that have worked with a Compass Project think of. They think of Mitzi, they think of Caitlin, they think of these people that have walked them through everything they needed to be walked through, gotten all of their applications filed, brought them things at their house that they needed in order to move what they need through the difficult systems that it sometimes takes to get what they need. So it's such an honor for me. But I really am so thankful for the team that we have here and the lives that they've been able to touch.
I was surprised. The person who nominated me is Sydney, our youth prevention coordinator, and I supervise her position. She did say one day, she asked me something, and she's like, "Just so you know, I'm nominating you for an award." And I was like, "Oh, okay." It's really nice. I really just, I don't love calling attention to myself, but I love calling attention to the work that we're doing here.
Yeah, I was really surprised when I saw the email, and I was happy. The Lawrence Community Shelter has always been a good steward of people. And one of the things I know that is often talked about here is how do we help people stay healthy? What can we do to get people those things that they're not able to get for themselves, and some of that is connections to health. When I was approached to start well, I named it Wellness Wednesdays. I thought it was almost a no-brainer to say, come here and talk to our folks and provide as many services as you can. And that will help us develop those relationships. To me, it goes hand in hand. When people have needs, that's why we're here. We know shelter is what gets them in the door, but it's up to us to talk to people to find out what those other needs are. And we do a good job at talking to folks and getting to know who they are individually.
There's a great opportunity to create a true navigation system connecting what we think of as healthcare providers, connecting them with all of the community-based organizations that provide health-related social needs. We as a community can be a leader, I think, in the state of Kansas in showing what that looks like.
Honestly, right now, our external affairs team, which is basically like outreach prevention, we have a really amazing team right now, and I appreciate their support. I completely just trust them. They've done such an excellent job. And so our interim executive director, Jessica Beeson, she makes doing this work enjoyable and easy, and I don't get to see everyone all the time, but for me, I constantly think about like our shelter advocates and our advocates doing direct service, because I've done that before, and it's a really, really hard job, and so I just appreciate them so much. All of this is so intertwined. When we have safe, sustainable housing, that helps a survivor get to safety quicker.
I want to thank everybody. I want to thank all of my staff from the last hire to the people that have been here the most. Since I've started in January, I just let people know that I'm here to support the team, because I in no way think I can do everything here. I can't do it without the input and the support of my team.